This lecture is on billing and reimbursement for nutrition services. So some of the things we'll cover in this lecture will be how nutrition services are defined. We'll find out which services are reimbursable, who pays for these services, and some steps that we need to take in order to get reimbursed, as well as what some of the rates are for certain services. And I'll leave you with some resources for to look at further. So the definition of nutrition services. Medical nutrition therapy is defined as nutritional diagnostic therapy and counseling services for the purpose of disease management, which are furnished by a registered dietitian or nutrition professional. So MNT is a specific application of the nutrition care process in clinical settings, and it's focused on the management of diseases. MNT involves in-depth individualized nutrition assessments and a duration and frequency of care using the nutrition care process to manage a disease. For nutrition education, this is defined as reinforcement of basic or essential nutrition-related knowledge. And then for nutrition counseling, this is a supportive process to set priorities, establish goals, and create individualized actions which acknowledge and foster responsibility for self-care. So that's how they're differentiated between. So what services are reimbursable? Well, for under Medicare Part B, the government will reimburse for medical nutrition therapy supplied for people who have diabetes, kidney disease. So usually this is for people who are in stage 5 and receiving dialysis. And also for kidney transplant if they've had one in the past 36 months. Hospitals, if we diagnose and treat someone for malnutrition, that's also reimbursable. And for private insurance, the different nutrition services vary by company to company. So, and also which plans the individual may be on. So it can be very varied. Some cover a lot of preventative measures, while other ones not so much. So who pays for nutrition services? Well, Medicare will pay, and as we went over the 3 diseases, so diabetes, kidney disease, or kidney transplant, those would be covered. In other states, Medicaid pays for it as well, however, specifically for California. So California's Medicaid is called Medi-Cal, and dietitians, unfortunately, at this point cannot enroll to be providers. So a lot of times what will happen in this case is that a dietitian will be employed by a doctor and then this will be billed on Medicaid through the doctor. Also, state workers' compensation can pay if you become a provider for them. So those are a couple of government entities that will pay. Private health insurance, again, it just is really variable on the types of nutrition services that they will cover. Most will cover the same as Medicare. So for the kidney disease and diabetes, those will usually be covered. Anything beyond that, it's really variable depending on the company. And then, of course, patients can pay on their own out of pocket. So how do we as dietitians get paid? Well, if we want to get reimbursed by Medicare, we must become a Medicare provider. And this involves a couple of steps. So first, we need to acquire a National Provider Identifier, or NPI. And this is considered a Health Insurance Portability and Accountability Act administrative simplification standard. So it's basically a standard of HIPAA. So the NPI is a unique identification number for covered healthcare providers. and it must be used in the administrative and financial transactions adopted under HIPAA. The next thing we would need to acquire is an employer identification number, or EIN. This may also be known as a federal tax identification number, and it's usually used to identify a business entity. However, it can also be for things like sole proprietorships or individuals. So if we're getting paid by Medicare by providing this business service, we need to get an EIN. And then once we have those, we're able to enroll as a Medicare provider, and we can do this online or by mail. Then we can also do provider enrollment for state workers' compensation, and depending on what state we're in, we can do this for Medicaid as well. For private insurance, we can go and become a provider for that insurance, so become in network with them, and then through that enrollment, we would be able to get reimbursed for whatever particular nutrition services that specific insurance company covers. And then again, we can also bill the clients. So give them an invoice and they pay before or after the services. Some places will do this, so the client will pay up front, and then the company or the dietitian will provide them with what's called a super bill. And this is basically an invoice that they can submit to their insurance company to see if the insurance will then reimburse the patient. So it kind of takes this step out of the dietitian's hands, and it's on the patient to try and get reimbursed from their nutrition, from what they've already paid up front to the dietitian. So for billing, we use the International Classification of Diseases, 10th edition clinical modification. So this has the CPT, which are current procedural terminology. So there's a bunch of different codes that code for various issues. So there's a specific one for malnutrition, a specific one for hemodialysis, and a lot of other nutrition-related diseases. So there is a document that I've supplied where you can see where the Academy has listed out some of the ICD-10 codes for dietitians that we would likely be using. Billing can also be done when in facilities by the accounting or billing departments. So they're the ones who deal with the insurance companies and the patients. You can hire a billing service company. So say you were in a private practice setting, you could have a service come in and do this for you. They usually charge about 7 to 10% of what is, billed or paid. So keeping that in mind, that you will be charged for this service based on that. Or you can do it yourself and learn these codes and make sure that you're billing properly, and so you can get reimbursement. But that does take some time, and there is a learning curve there for understanding what qualifies for each of these codes. So for rates of nutrition services from Medicare, this shows the fee schedules for dietitians. So when they have the RD non-facility rate, so that might be like private practice, whereas the facility rate is going to be hospitals, skilled nursing facilities, rehab or ambulatory or outpatient facilities, continuing, and also any community mental health centers as well. And we can see these are for the nutrition service provided is MNT, and it's broken up based on individual versus group, as well as initial assessments versus reassessments. So for each 15 minutes of an individual initial meeting, if this was done in private practice, then the dietitian would receive about $33. And this is changes depending on what part of the country you're in. So this is specific to Orange County and Los Angeles. And then, so we can see we get paid a little less for the reassessment. So again, these are in 15-minute increments. So for the group, it's in 30 minutes. So if we had an hour-long group session, it would be this $15 times 2, and could get reimbursed $30 for that group session. And then the facility rates are a little bit lower. So here are some of the reimbursement resources. Most of what I got for this lecture was from the Academy of Nutrition and Dietetics. They have resources, and if you go to their section that says Getting Paid, you can find out more information there. And then another place, there's a book that should be coming out called California Nutrition Reimbursement Guide, and it's by a dietitian who's been in practice for 30 odd years. And so she is completing this book, and hopefully it will be available for purchase for those of you who want to get more information on specifically reimbursement in California. And that is her website there.